Hello, I'm Annabel Tiffin, patron of the Diane Oxbury Trust. The Trust was set up in memory of my friend and colleague Diane Oxbury, who was the weather presenter on North West Tonight for many years and sadly died of ovarian cancer in 2019. Now, our aim is to let people know more about the potential symptoms of this disease so that they can go to their GP as early as possible and get help. Diane was passionate about improving the lives of others, so we're delighted to be working with the NHS and Target Ovarian Cancer on the This Van Can roadshow. I think Diane would love the fact that the roadshow is taking these important messages out to people across Greater Manchester, making advice more accessible and hopefully saving lives. So please pick up a leaflet, have a chat with the team and have a look at the information that's on board here. And if you are worried about any symptoms, then please do make sure you visit your GP.
My name's Hilary. I'm 64 years old and I've had ovarian cancer. I was getting tummy pain and it wasn't going away, so I made an appointment to see my GP. Well, my GP examined me and could feel a lump in my tummy and referred me for an urgent blood test and a scan. The blood test showed a rise in something that suggested I might have ovarian cancer, and the scan showed I had a lump in my tummy. Well, I was referred urgently to see an oncologist who specialises in ovarian cancer, and they did lots of other tests, and I had surgery to remove as much as they could of the cancer, and then started chemotherapy and had a full course of chemotherapy. I was very fortunate. By the end of it, I was completely in remission, and I have remained very well since then. It hasn't come back, for which I'm very grateful. Completely over the surgery and the chemotherapy now, and I enjoy walking, gardening. I have 2 dogs that I enjoy. I've got lots of hobbies and friends, and living life to the full and feeling very well now. If you have any of the symptoms that could possibly be ovarian cancer, do make an appointment to see your GP and discuss your worries with the GP. It's quite likely that it won't be anything as serious as ovarian cancer, but it is important to rule it out.
I'm Charlotte, I'm 34 now, and I'm a GP in Greater Manchester, and I had ovarian cancer at the age of 31. So after my diagnosis, I had surgery to remove the cancer, and I'm now pleased to report I'm doing really well. I'm back at work, and I've been fortunate enough to have a baby girl, and I live a very active lifestyle now. I also teach dance fitness classes. So as a GP, what I would tell my patients is if they have any of the following symptoms, that would be pain in the tummy area, feeling more full than usual, bloating, and weeing more frequently than usual. If they have these symptoms persistently and recurrently over a period of time, then they should see their GP for further tests. That might involve a blood test and a scan of the abdomen and pelvis, so the tummy area. The chances are it's not ovarian cancer, but it's really important to just get those symptoms checked out. So you can pick up a symptoms diary today on our van, and what this will allow you to do is record the symptoms that you may be having and how frequently you're having them, and then you can take that symptoms diary back to your GP, which is a really helpful tool to start a conversation about potential ovarian cancer.
I'm Nadia Ali Ross. I'm a consultant gynaecologist in the NHS, and I'm also the Gynecology Cancer Clinical Lead for Greater Manchester Cancer Alliance. Ovarian cancer is a bit of a difficult cancer to recognise, but non-specific symptoms such as abdominal bloating, early feeling full easily, that you don't want to eat, increase in heartburn or indigestion, unexplained weight loss, and sometimes you may notice changes in bladder function, going to the toilet more often than you used to. If any of these things happen increasingly frequently, more than half the time in the past month, or have occurred for 3 or 4 weeks and they're just not settling, these new symptoms, then seek advice from your GP. So when you go to your GP with symptoms that may indicate ovarian cancer, your doctor will take a history from you to understand how long you've had the symptoms and assess whether you have any specific risk factors, such as a family history of certain types of cancer. In women, particularly over the age of 50, the baseline test that your GP should arrange should be an urgent pelvic ultrasound scan and a blood test called CA125. And these are to look for any obvious cysts on your ovaries or raised blood test results that may indicate you need more urgent investigations. Treatment for ovarian cancer very much depends on the stage of the cancer diagnosis and the type of cancer. It can involve surgery to remove the cancer itself and any organs the cancer involves. It may involve chemotherapy, and in some occasions it requires a combination of both these treatments to give the best cure rates. If you have symptoms you're worried could mean you have an ovarian cancer, you need to contact your GP and arrange an urgent appointment. And your doctor will be able to take you through what symptoms you have and work out which ones are of more concern than others and refer you for the appropriate tests if needed. There are some misconceptions around ovarian cancer. One is that there are no symptoms or very few symptoms associated with an ovarian cancer. While this is true in early stage cancer, many ladies who present with ovarian cancer actually look back and see that they have actually had symptoms, quite non-specific symptoms such as feeling bloated, maybe more frequently than previously, increase in heartburn, pelvic discomfort, feeling full quickly, and sometimes just simple changes in going for a wee more often. So if you find you've got symptoms like these, please don't ignore them if they're persistent. Seek advice from your GP.
So one myth is that 40% of women think that having a normal cervical smear rules out the chance of having ovarian cancer. However, a cervical smear is a screening tool to help to reduce the chance of getting cervical cancer in the future. It doesn't test us in any way for ovarian cancer. So if you do have any of those 4 symptoms of ovarian cancer, it's really, really important that you see your GP and they consider doing further tests into those symptoms.
Another misconception I've sometimes heard is when women have had a previous hysterectomy, they assume they can never get an ovarian cancer. It's important to understand that a hysterectomy does not always involve the removal of the ovaries. So if you have non-specific symptoms that may suggest an ovarian cancer, please check with your GP, arrange a review with your doctor so they can explore these symptoms further with you. Also, if you have had a hysterectomy where your ovaries were removed in the past, there is a rare chance of developing an ovarian type cancer called peritoneal cancer that may present with very similar symptoms to ovarian cancer. So again, if you get any of the symptoms we've discussed in this video clip, please make an appointment to see your GP urgently for review.